Jordan Watenberger. Period. A new paragraph. Jordan was noted to have amniotic band syndrome at birth. He has been under the care and was originally living in South Carolina. He began care at the Greenville Shrine, at which time he underwent casting, manipulation and casting for his club feet. He was placed into Ponseti bar, and most recently he underwent a Z-plasty of his left lower extremity. Period. There's been no need for increasing pain medication. There's been no fevers, no discharge, or any signs of infection. Period. New paragraph. Birth history. He is a 5-pound 10-ounce product of a scheduled C-section for a twin birth. There were no perinatal issues which required hospitalization. Paragraph. Past medical history is significant for bilateral talipes equinovarus, also for amniotic band syndrome. New paragraph. Past surgical history is significant for serial casting and for application and for a Z-plasty by Dr. Watenberger. New paragraph. Current orthotics include Ponseti bar or Ponseti shoes with a Dennis Brown bar. Tag. A physical examination. General Jordan is a well-nourished, well-developed, now 17-month-old male. A new paragraph. Examination of his gait today shows he is able to ambulate with his cast on. New paragraph. Spine shows no gross curvature, rotational deformities, no venous malformations, serrated patches, or sacral dimpling. New paragraph. Lymphatic shows no dependent lymphedema or swelling. New paragraph. Cardiovascular, he has well-perfused upper and lower extremities, 2+ dorsalis pedis pulse. New paragraph. Skin examination of his skin today shows that he has excellent healing of his Z-plasty on his left lower extremity. There are multiple chromic sutures, what appear to be chromic sutures intact. New paragraph. Muscle skeletal shows that he does have positive multiple congenital or finger amputations across both the right and left hand. Examination shows 5 uniform digits on the right foot and also 5 digits on the left. Examination shows that he can be ankle dorsiflexed on the right to greater than 10 degrees. He shows a mild degree of behind forefoot adduction, but otherwise this can be passively corrected. Tag impression is 1, amniotic band syndrome. Now 3-week status post Z-plasty left lower extremity. 2, bilateral talipes equinovarus. New paragraph plan. At this time he is doing very well. From my standpoint, I would like him to continue with his nighttime Ponseti shoes and Dennis Brown bar. Regarding his left lower extremity, I encourage his family to communicate with Dr. Watenberger. I do not see any need for intervention at this time. I would like to see him back in 3 months' time. At that time, I would like his mother to ensure she brings in his Ponseti shoes and Dennis Brown bar to assess for fitting size. Period. New paragraph. From that, otherwise he has no orthopedic limitations. I've reviewed this entire course of care both with Jordan and his mother and have answered their questions. Thank you for allowing us to participate in the care of your patients. Sincerely, Dr. David Amstrap. Please forward a copy of this to Dr. What's his first name? Dr. Watenberger at the Greenville Shrine, and also to primary pediatrics.
Dr. Glaze.
Yeah, to Dr. Jeffrey Glaze at Auburn Pediatrics.